Patient safety has been and continues to be a major issue in healthcare today. The purpose of this video is to inform nurses about the increasingly prominent issue of patient safety, how technology is affecting risk of medical error, and how nurses' jobs relate to patient safety on a daily basis.
On average, healthcare errors kill 44,000 to 98,000 patients in U.S. hospitals annually.
Adverse events cost the United States about $17.1 billion in 2008. Despite these alarming statistics, there have been many recent technological developments and strategies that can be implemented to reduce the annual death toll in healthcare. Barcoding is about a 2 mm square that consists of different black and white configurations that displays all relevant patient information when scanned. Oxygen saturation is a critical measurement in patients experiencing respiratory depression. The pulse oximetry devices display oxygen saturation in a way that allows nurses to see whether the patient is breathing properly or whether he or she needs more help breathing while under anesthesia. This technological advance reduces medical error in the operating room by keeping patients breathing properly while in surgery.
The electronic health record allows patient data to be stored in a manner that is accessible to both patients and nurses, allowing them to better manage the patient's health by using capabilities provided by enhanced clinical decision support and customized education materials. Dr. Tracy Fasolino is a professor with the School of Nursing who also works as a nurse researcher at St. Francis. Dr. Fasolino holds the topic of patient safety near and dear to her heart since she first did her dissertation on the topic many years ago and has been involved with patient safety since then. In this interview, Dr. Fasolino discusses the electronic health record as well as pinpoints the major disadvantages of recent healthcare technology.
The other piece is the electronic health record. That has been the biggest push from an inpatient setting because it's been a requirement that everybody's patient records are in electronic form. And we were all excited about that. We thought this was going to be the best thing since sliced bread, that I could go back 5 years and look at patient records. But the electronic health records that we're using are incredibly fragmented. You can't find things, different places are showing up. It's not mainstreamed. You can't even really get a whole picture of a patient's hospitalization by looking in the electronic health record. So I think that's created a lot of fragmentation because of that. And nurses have all kinds of different assessments that they do in the EHR, but they don't link themselves together even, so you can't keep track of some of these.
Technology is constantly being improved, but it is far from perfect. Nurses will find many benefits through the use of technology at work, but they will also face several challenges. Dr. Fasolino shares her opinion on what nurses can be doing now to prepare for technological innovation in their future.
And I will tell you, one of the key things that you need to do is to be innovative and open-minded. That if it don't fall into that trap that this is what I have to work with, so I'm going to have to learn, think outside of that. Say, I don't like that, I want to change that. I want it to be different. I want it to be able to work this way or that way for technology. There's, I think, we have several things that we have here in our lab that we use from a technology standpoint. Don't be afraid to speak up and say, that just doesn't work well that way, and start challenging what has become some of the norms so that we're not just continuing down that road of poor systems.